honor and pleasure of speaking with Dr. Alexandra Kreps. So thank you so much for joining us today.
Thank you for
And
having me.
it's a pleasure having you. So Dr. Kreps, can you become a doctor?
So since high school, I've always had an interest in math and science, always excelled in those fields. I was one of three girls in an AP chemistry class. So I knew that was unique. They had to make the class for us because it didn't even exist before then.
Good for you.
And then I went on in neuroscience and behavioral biology and really dove deeper into medical sciences and just really loved the subject. And always in the back of my mind, I think since I was younger, thought I wanted to be a doctor. And so it just kind of made sense with my interests and my love of community service and helping others. So it's kind of how it all came together.
You're trained in one way, but you seem to look at things very differently. So if you can, kind of give a little hint or tidbit of your personal health philosophy and what you like to do.
Sure. So I would say my approach is a bit more holistic, a little bit more comprehensive. I really like to delve deep into the patient's medical history, but also their life, get more of a 360 view about what's going on in their life, what are their stressors, how do they sleep, how do they eat, and how's their job, how does their job affect them, and just sort of look at factors to really understand the person. And that's something I always loved about people. And I think that can give you a really good idea of why they have a certain medical, why they're dealing with certain things. And, stressed people, their blood pressure goes up. So they're all related. I think that approach to multi-specialty practice really provides a primary care doctor with a lot more support, and the patients also really love that specialists can really offer a lot of knowledge that a primary care doctor. So that's something I also love to incorporate other specialists and have strong communication and let the patients know that we're communicating as well.
All right. And now personally, what inspires you personally?
I think something that's always inspired me is food.
Okay.
I've always loved food since I was food, every Cheerio, every grape. And, as I got older and went into medicine, that love of food continued and my love of cooking continued that my mom really passed on to me. And I love, cooking and sharing recipes, watching every TV show related to that, following every social media related to food, and even kind of integrated that into my practice. I love working with nutritionists because I love learning more about food and kind of like the health and science behind food. So I guess food is really my biggest passion. People, when they ask me, what would you do if you were in a doctor? I always say I'd be a chef or some food business, because I guess that's what always fuels me. Even, when traveling, that's the number one thing I'm looking out for is where are we going to eat? Let's get a list of restaurants.
That's
how
awesome.
we can plan them out and hit as many as possible in one day.
Are you opening a French restaurant?
Yeah, sure. French restaurant sounds great.
All right, because I know you're fluent in French.
Yes, I think it would be French Mediterranean or something of that hybrid.
That sounds perfect.
Yeah, so I guess that's my real love outside of medicine. And one time I was going to see Anthony Bourdain speak about a new book he had just come out with, and I was waiting outside of the Union Square Barnes & Noble, and he happened to be there just walking in, getting ready to go speak. And I never go up to celebrities, ever. I'm too shy. But I just tapped him on the shoulder and I gave him just, a whole speech about how much I love him and how much he inspires me. I just felt the need to do it.
That's awesome.
He's really my hero. So,
getting back to your medicine at this point, I know you have so many different patient stories, but is there an example of a patient story that you're kind of happy with, or you loved how it worked out, or just something that kind of stands out, or a story that you want to share?
Sure. Um, so one patient that we had shared, he had first come to you. I think he'd also seen physical therapy. He was a middle-aged male. He came to me just for a primary care visit. You know, he had been going to other primary care doctors before. He was, you know, up on all his health screenings and vaccines. You know, and one thing I love to do is just give patients a little more time to explain what's going on. Tell me as much family history as possible. Tell me, you know, what's stressing them out. And he was very stressed out. He was starting a new job. And the new job, you know, required a lot of hours, a lot of traveling, required a lot more demands than he was anticipating for being a senior level executive at that firm. So you know, we get to a point where I ask him just a couple more questions, and something went off in my head and said, something's a little bit off. You're very stressed out. Your blood pressure's up. Your labs look okay, but you know, I think that I want, you know, there's a little bit more here going on. And so I basically went through an algorithm called the ASCVD algorithm, which calculates your risk of strokes and heart attacks, and found that his was very, very high. And this is a bit of a newer approach primary care doctors are using. So, you know, I'm closer to residency maybe than some others. So maybe I had just, you know, remembered this algorithm and thought, okay, maybe this is worth plugging in. You know, we have the time, and I'm giving you the time, and I'm listening to what you're saying and your history and your family's history. And it ended up being very high. So I sent him to a cardiologist, and the cardiologist was like, wow, you know, this is impressive. It's very subtle, but it's very severe. So he ended up getting a lot more testing, and in the end, he actually had to go for a bypass procedure and a stenting, and it was really, you know, it was scary that I had sent him there, and now he's getting this whole surgery. But he was so grateful for in the end, and it ended up being a success, and hopefully, you know, saving his life. You know, it was a very it was a tough case, but it was really rewarding. And I'm so glad that I gave him a little bit more time to tell me about his history, because that really, I think, made a big difference in diagnosing him and getting him the right treatment.
I mean, I remember receiving an email that his kids wrote or something like that, thanking you for saving his life. And you know, to see an email from that, to see the difference that you're making in the office and the patients' lives is literally just humbling. So I can't thank you enough.
My
So
pleasure.
in Tru Whole Care, right, we really have a unique perspective about it, right, where we're looking at what we call Tru Whole Care. And I know you have a team that works with you. If you can just tell them about your team and why you assembled the team.
So I work closely with you, of course, and also the nutritionist Willow, and mental health therapist Erica, and we essentially have developed what's called an executive physical, or Tru Whole Care assessment, as we like to call it. Um, and essentially, we have patients go through several providers: a chiropractor, a mental health therapist, a nutritionist, and a primary care doctor. So they'll start typically with Dr. Sinett or I, and then go to the other specialists. And by doing so, and then they'll come back to me. So we're able to really assess them on a more comprehensive level, looking at, through mental health, we do a biofeedback assessment, looking at their stress levels, their anxiety, looking at nutrition, looking at what they're eating, what, you know, what they love to eat, what they don't love to eat, what's causing problems with them. and then have them see a chiropractor, add that physical medicine component. And then they'll come back to me, I'll create an executive report, and that'll kind of sum up the mind, the nutrition, the physical therapy or chiropractic level. And this creates a really 360 view of the patient, and really what's going on with them, what we can work on together, and get really a much more holistic approach to the patient, and how they can change just minor even lifestyle changes that could make a huge difference in their everyday life. So we really developed this to give patients better care, better true whole care,
Yeah.
which should be the objective of all of medicine, really. And the real beauty of it is that the communication between the specialists, these patients are getting, a very personalized approach, because all of these specialists are working to figure out what their problem is. Not anyone's problem, not an algorithm, but their problems and issues and how we can help them.
Well, again, first off, thank you so much. But you are the true essence of Tru Whole Care, because you're coordinating and you're making sure that we're looking at everyone's true whole care by looking at their structural system, their emotional system, their digestive system, and their medical system. So you are really the captain of the team in that.
And they're all interrelated, so it makes perfect sense.
So just thank you, and I appreciate you taking the time.
Thank you.